My name is Dr. Goncalves. I'm a general surgeon and I work at Rutherford Surgical Associates in Rutherfordton. Endoscopy is a procedure in which we take a lighted scope with a camera and insert it either into the mouth or in the backside. And we can use the scope to navigate through the GI tract and make diagnoses. When a patient comes to the office, we'll ask them a variety of questions. Usually they're complaining of some type of abdominal pain, and based on the types of symptoms they have, a lot of times it's heartburn, sometimes it's abdominal pain or rectal bleeding. We can figure out what form of endoscopic evaluation they need based on their complaints. Preparation for the upper endoscopy, which involves looking in the throat, the esophagus, and the stomach, is very simple. The patient is instructed to eat or drink nothing after midnight, the night before the procedure. For the colonoscopy, that involves taking a bowel preparation. It's a prescription substance that's given to a patient, and they're given instructions to prepare. The day before, they're drinking clear liquids and drinking this solution during the day, and they'll be going to the toilet frequently, and that way their colon will be clear for the procedure the next morning. When we do an upper endoscopy, we're classically looking at the esophagus to see if there's any signs of acid injury or something called hiatal hernia, where the stomach has gone up into the chest. When we get into the stomach, we're also looking for signs of acid injury, polyp disease, inflammation, or ulceration. We're looking for similar type things in the first part of the intestine, which is the duodenum, and that's the furthest extent of the endoscopy. For the lower endoscopy, we have the ability to navigate the entire colon, and we're looking for inflammatory changes. We're looking for diverticulosis. We're also looking for polyp disease, and we have the capability to take pictures, to do biopsies, remove tissue, and also do cultures. Reflux is the abnormal regurgitation of stomach contents back up into the esophagus. There's a sphincter muscle at the junction between the esophagus and the stomach, which is supposed to prevent that. A lot of people have that area weakened, and that results in the abnormal regurgitation of food, which also contains acid, which burns the esophagus. Most people will present with an uncomfortable chest pain, discomfort, heartburn, or the sensation that fluid is coming back up into their throat. With reflux, the patient is evaluated first with upper endoscopy and also a special study to gauge how well they swallow. Based on those two studies, we can determine if a patient is a good candidate for reflux surgery. With any reflux surgery, it involves correcting any hernia which may be present, and in addition to that, we would perform a wrap, which involves taking the upper portion of the stomach and wrapping around the lower section of the esophagus to create a new valve so that food and acid cannot regurgitate back up into the esophagus. A hernia is when contents inside one specific cavity in the body protrude out either through the skin or into another body cavity. Hiatal hernias are when the stomach contents are pushed up into the chest. There are a variety of other hernias that we're more familiar with. A lot of men and women will present with inguinal hernias, which are hernias in the groin. And a lot of people will also present with umbilical hernias, which are right around the belly button. Some people will come in with hernias from previous surgeries, and those are called incisional hernias. The principle of hernia repair involves reducing the contents of the hernia back into the cavity from where it came. The defect itself has to be bridged or repaired. And most of our hernia repairs nowadays do involve some placement of artificial or biological material to reinforce the repair. The repair can be done laparoscopically through poke holes and a camera, and a lot of repairs can be done open, which involves making an incision, reducing the hernia contents, and then bringing the abdominal wall or musculature back together, reinforced by mesh. When somebody is recovering from hernia surgery, there is a mild to moderate amount of pain, which does require some recovery time. Most people are not incapacitated, but have a significant amount of pain to where going back to work for the first 2 weeks would not be a good idea. After that initial 2-week period, they'll start to improve, but in terms of resuming physical activity, regular physical activity, it'll take upwards of 6 weeks to fully return to normal activity.